Welcome to the Power of Peacefulness podcast. We're all about bringing peace into your life. If you like this podcast, do me a favor, give it a thumbs up. And if you need some extra help, go ahead and download my free resource. You can find that at SharonMcLaughlinMD/workbook. It's a workbook all about peacefulness. So if you need some peace in your life, try the workbook. All right, let's get started. Hey, everybody. Today we have Dr. Valerie Cacho with us. She is a sleep specialist. She's going to be talking to us about the problems with sleep, why they're occurring, and more importantly, what we can do if we are having trouble sleeping. Valerie, thank you for being here today.
Thanks so much, Sharon. Happy to be here.
I always start off with, why are you passionate about this particular topic? You have basically gone all in. I see you all over social media. You're an expert when it comes to sleep. What draws you to this?
Great question. And let me go back to childhood. I don't want to go too far back, but my dad was an interventional cardiologist and he did not sleep very much, right? He'd wake up 2, 3 o'clock in the morning, rush to the hospital, cath someone, and then do a whole day of clinic. It was back when, the cardiologist would do clinic, hospital work, and I think now it's a little bit different. And early on, I had a very interest in science, but I knew I didn't want to work like that because I wanted to have, the family life. I wanted to have kids and be able to, hang out with them and support them, aside from, going on vacations, which is pretty much when we started. And then just throughout medical school, just learning about different aspects of medicine, it really spoke to me because I think, preventive health, lifestyle medicine is so important. And just realizing all the connections sleep has to our overall health and wellness, right? If you don't sleep well, you can get sick, you can even increase your risk for cancer, and you can have fertility issues, mood disturbances. They all can come back to the foundation of what sleep is so helpful. And then, sure, as going through medical training, they sort of train us not to sleep. I was in the era where we work 30 hours plus, and I remember, working a full night in the emergency department, admitting patients, and then the next day doing cardiology clinic. And I was falling asleep talking to people. And the nurse practitioner that was there just told me that it's okay, go home and take a nap. And I was just like shocked. And I was almost like shamed that I was falling asleep, but just realizing the humanity, right? We're not supposed to work all the time. I even talked to some of my patients. If you take a look at your computer, depending on what kind of computer you have, your computer has a sleep mode, right? Even machines need to rest. And so just really talking about the importance of sleep, how it can improve performance, your health, your metabolic state. And so many women have difficulty with sleep. And I think it's a bit sort of a badge of courage. We're all tired. You talk to your friends, they're tired, they're working full-time jobs or maybe, taking care of elderly parents and their kids and also trying to do a side hustle. And it's almost like, yes, you can do all those things, but you can also get good quality sleep. And so that's really my message, that it's okay to rest. It's okay to have sleep. Because guess what? Other aspects of your life will really improve if you're getting the quality sleep that you need.
Love it. All right. So what are you seeing out there? What's going on with women? Why are they having a hard time sleeping?
The way I like to break it down into a framework is mind, body, and soul. So mind, right? You have a hard time falling asleep because maybe you have ruminating thoughts, you're stressed, maybe you're going through perimenopause and menopause, and those hormone fluctuations are causing you to feel more anxious. Body, this is something that I see a lot in my clinic. Are you developing obstructive sleep apnea? And it's those things that's a little bit shameful because, again, there's a whole gender bias in medicine where we think, snore like a man, women shouldn't be snoring. But research actually shows that women can snore just as loud as men, right? They did a study where they put people in a lab and they saw the decibel count was just as loud. And about 30% of women didn't even think that they snored, which is sort of phenomenal. And so I always like to sneak this in and talk about obstructive sleep apnea for women because it is quite common and up to 90% of women are undiagnosed. As we get older too, we have more health issues, whether it be waking up to urinate at night, maybe from diabetes or, it's hot out, we just drink a lot of water. Medication side effects can cause that. Medication side effects can cause disrupted sleep. As we get older too, we have, joint pain, muscle aches. And so sometimes it's hard to find a good position. So talking about simple things like special pillows or, your body position, how you can use that to support your sleep. And then soul, and it goes back to, are you living the life that you are supposed to live in terms of, is your career where you want it? Or are you thinking about retiring? Or do you have that side hustle? right? Or is it time just to transition to something completely different? Is it okay to retire in your early 50s? And what would that look like going forward? So those are conversations that I have with my patients, seeing where it is between the mind, body, and soul. And the beauty of this is it's sort of an art, right? It's sometimes more than just one thing.
We were talking before we started recording. Tell me about why stress is the ultimate, like why, how do I say this? Why sleep is the ultimate stress relief.
Yeah. Well, what happens when you sleep? You're actually unconscious. And so, the stressors of the day ideally are going to be not as bothersome. I mean, you can still dream, and there's different stages of sleep. There's stage 1 and 2, which are light, stage 3, it's deep, and then there's REM sleep. But as you go to sleep, right, you think about, as the day goes along, you're building up all these toxins. These toxins get built up in your brain. Your neurons are firing, and all the things that you don't need anymore start to get pruned away. And so when you get an adequate amount of sleep, it really could it cleans that itself out. But you need to have enough deep sleep. And so making sure you're getting an adequate amount of sleep. And when we were trained in sleep fellowship, one of the first things to go if you're sleep deprived is your mood. And I can attest to that myself. I'm a little bit more snappy, a little bit more grouchy if I don't get enough sleep. And then when you are able to handle sort of, the day-to-day situations, right, it can bring more stress. Your resiliency goes down. And so that's how I think really sleep is the ultimate, stress reliever. It makes you more resilient. The emotional tax of, stressful events may not impact you as much when you got a lot more energy, right? You just have more fuel in your tank. You have more battery in your battery pack, so you can last longer. And the best part, it's free. And I think one of the biggest issues is we don't always prioritize it, right? We go through our day overscheduled, going from one meeting to the next or the next to the kids. And then by the time it's dark, it's like, oh, now I can relax and, have my own time, which is important. But if it sneaks too much into, you're not getting adequate sleep, how much is it really serving you during the daytime? Yeah. And we really, really need only 7 hours of sleep. So, depending on when you need to wake up, you can go to bed at midnight, right? And wake up at 7 in the morning and still feel pretty good. Yeah.
Let's talk about some of the myths that are associated with sleep.
I think one of the biggest is you need 8 hours of sleep. Some people do, granted, but there was a huge research study done in Canada of over 4.4 million people in over 30 countries in the world. And they looked at 14 different health outcomes. And really what it came down to is if you were getting at least 7 hours, you were doing pretty good in terms of high blood pressure, in terms of stroke risk, in terms of metabolic health, which is really encouraging because I think, probably when I was younger, maybe when you were younger as well, things in the, things in the pop media at that time, like Reader's Digest, would tell us, okay, you need 8 hours of sleep and 8 hours of sleep. And so sometimes people come to me and they say, I read something, if I don't get 8 hours, I'm going to develop dementia. And I like to think about, something like a piece of the pie. If you have your, dementia pie, how much of it is, for me, I'm really biased, so it's a big part, but it's only one piece, right? Your diet, your exercise, your genetics, those can play a role as well. So I think that's a huge myth. How much sleep do you really need for adults? They do say somewhere between 7 to 9, but I would say it's probably okay to get 7. I think for me, 7.5, 8, I do feel good, but, if I get 7, it's still gonna be a great day. Yeah, so I think that's one of the biggest sleep myths that I see. Another one is needing something to sleep, and so this is aside from somebody who has sleep apnea and they, do need a breathing machine, a CPAP machine to help them sleep. What I mean by that is taking something. And, really there aren't any shame in needing to take medications or supplements if they are helpful. But I want to just sort of offer it is not the only option because some people don't realize that you can train your brain how to sleep, which sounds a little bit, counterintuitive, right? Sleep is as natural as drinking water, breathing fresh air, going and getting some sunshine. But sometimes we lose our way. So the way I talk about insomnia with some of my patients, and maybe this dates me, my first car was an old Toyota Tacoma and it had a tape player. So I put the tape, in the player and I hit play. And most of the times it would work. But sometimes, remember, it would come out and the ribbon's all tangled and you're like, oh, okay, you get to untangle the ribbons. And so that's just sometimes how life goes. Our sleep tape, you stick it in the little tape player and, it works pretty well. But then guess what? Maybe we have a kid, maybe we go through residency and fellowship and then we work 7 days on, 7 days off. Or maybe we, move cities, or maybe our parents get sick. And all of those stressors add on top of it. And it's like the tape is so tangled up. And guess what? Magnesium doesn't help unravel that. Melatonin doesn't necessarily, valerian, ambient, those things may help because, research does show it does slow down your brain waves. But really what's helpful is something called cognitive behavioral therapy, right? It takes a look at all the little tangles, right? Sort of, I call it like peeling back the layers of the onion and what's behind that and how can really support you and help you sleep again. So that's something where you can train your brain how to sleep. You don't have to rely on a pill. And they can only do so much. I sort of call sleeping pills and hypnotic pills and over the counter. It's just like pain medications. They're really helpful in the acute case, but right, if you fall and break your arm, it's not going to do anything to reset that bone, right? You got to go see the orthopedic surgeon to get that fixed up.
So we hear so many people are exhausted. How do we overcome this exhaustion?
Yeah, great question. So me biased again, I'm going to look at how many hours of sleep you're getting. Are you prioritizing sleep? Could you have an underlying sleep condition, whether it be insomnia, restless legs, any abnormal movements at night, a breathing condition? I also order some vitamins because, if you do have low vitamin D, that can impact your sleep, B12, that can impact your energy. Typically, the patients who come in already and see me already had their thyroid checked, make sure they're not anemic. Those are the big ones as well. And then sometimes looking at their schedules. I do a little bit of coaching, even though technically I'm not a coach, but it's like, are you giving yourself, at least 7 hours to sleep? So what needs to be either delegated, deleted, or just done on that to-do list? And sometimes, let the doctors on this, we're quite ambitious people. We want to do all the things and have all the things, especially we're on social media and we see a lot of us doing all the things. And it's okay to take a step back, right? It's okay to take, I think for myself, my newsletter, I took pretty much June off because we were traveling and there were conferences and felt a little bit guilty, but it's okay. People are still going to read it when you come back. Everyone needs to sleep. And so the information is going to be there. And so I think one of the biggest things is if you are feeling exhausted, if you are feeling overwhelmed, just take a step back and give yourself, maybe an extra 15, 20 minutes, even 30 minutes of rest, whether you're sleeping or not. Give yourself some quiet time and just see how you feel.
Love it. What about for those who wake up in the middle of the night and they can't go back to bed? Any advice there?
Oh my goodness, this is my favorite question. I always like to listen to how other sleep doctors answer this question too. Yes, I would say number one, because I'm so biased, is make sure you don't have untreated obstructive sleep apnea. And so up to 90% of women who potentially could have it are undiagnosed just because there's so much gender bias in medicine. But also 40% of women don't have the classic symptoms, which are snoring, gasping, or choking. What do women have? Basically waking up in the middle of the night, headaches in the morning, mood disturbances, fatigue, even some nightmares. And that could be obstructive sleep apnea. Another thing too is, when you talk to someone who maybe could have it, they're a little bit sort of reluctant to do the sleep test because they're like, I don't want to wear that mask. And it's like, well, that mask is only one option. There's like this mask just goes underneath the nose, over their nose, or mouth guards. Sometimes people can just sleep on their side, get an adjustable bed, use a couple of pillows to prop themselves up. So that's, I would say, number one. Number two, I would say, well, goes back to the body thing, is your bed comfortable? Are you having aches and pains that, causing you to wake up? Are you waking up to urinate? Which actually cycles back to untreated sleep apnea. Untreated sleep apnea is associated with nocturia. So make sure that's not all sorted out. If you're going through perimenopause and menopause, we do know research does show as our hormones fluctuate, and especially as they go quite low, the estrogen, progesterone, we tend to be lighter sleepers. Right. And so knowing that and having that information can be helpful. And if you are a candidate, if you are interested in getting on hormone replacement therapy, it has been shown to help as well. Another one is stress, right? And as we go throughout life and as we go out throughout the day, sometimes, there's things that weigh on us. And if we don't take that time to be still and be quiet, it can come up in the early mornings, right? Because after we get about 4, typically 5 hours of sleep, our sleep isn't as deep as it was the first half of the night. And so also depending on when you eat, you your body's not making any more glucose. So there's a natural rise in our cortisol level, which is good because, you need cortisol to make you feel awake and alert. But also, if your blood sugars go too low, right, that's not compatible with life. So some of the research shows that people who have higher levels of stress have higher levels of cortisol. So a higher baseline cortisol in the early morning potentially could also be waking you up. So that's something to be mindful of, which is, okay, well, how do I fix that? Well, control your stress, get more sleep. That can definitely help. I think probably there may be more research coming out now that we have more continuous glucose monitors. Sometimes a relative drop in blood sugar can also wake people up. And then I like to think of the normal things. So I just made a video of this. Normal things that can wake you up in the early morning are actually you're going to bed too early because we all have clocks within us, our circadian rhythm. Most people are sleepy around 9 or 10, but some people have a phase advance. So maybe their true bedtime is 8 o'clock. And so if you're sleeping around 8 o'clock, but maybe your partner's still up, you're watching TV together, that's your only time together, and you push your bedtime to 10, if your true wake up time was 8 hours later, from 8 o'clock to 3 o'clock, guess what? That would be a normal awakening for you. So there's a questionnaire that I encourage people to check out. It's called the morningness eveningness questionnaire. Another simple way to do it is, if you're on a deserted island or in a cabin in the woods, you had no responsibilities, nothing that you need to do, when would you actually go to sleep? And if it's a little bit earlier, then that's your true bedtime. And then on the opposite side is sometimes, maybe your true bedtime is 2 o'clock in the morning. And you think you have insomnia because you want to sleep at 9 because you got to wake up at 5 to go to work. But in actuality, you're just a night owl trying to live a day person's life. So can you switch your social calendar around that? If not, you can use things like light to help phase shift you.
This has been so informative. Thank you.
A long-winded question, hopefully answer some of the things that ladies are thinking about.
If people want to get a hold of you, how do they do that?
Thanks for asking, Sharon. So if you're located in either Hawaii or California, I have my own medical integrated sleep medicine practice called sleeplifemed.com. For everyone else, I put out free resources on YouTube all about women's sleep and co-living, and that's called Sleephoria.
You also have a book. Let's talk a little about that.
Yeah, so I did the online integrative medicine fellowship at the University of Arizona with Dr. Andrew Weil. And so when I was part of that program, he contacted me and the other sleep doctor who was in the program. And we wrote one of the series for one of the books for his series all about integrative sleep. And it was pretty phenomenal because things that I got to learn a little bit more about, like how energy medicine can impact sleep. There's a whole chapter about cannabis. There's a whole chapter about mind-body therapies, Ayurvedic medicine. And so going beyond the pill, right? How can we improve someone's sleep? There's so many ways to do so. And that's sort of one of the joys I like to practice integrative medicine, because it really just expanded my toolbox to give people other options to help improve their sleep and their overall life.
All right. So the website, could you spell that out?
Sure. It's Sleephoria. So www.sleephoria.com. Yeah. And Sleephoria is the online educational resource. And it's really founded on the belief that a well-rested woman has the energy, clarity, and drive to change the world.
Dr. Cacho, it's been wonderful speaking with you.
My pleasure, Sharon. Thanks so much for having me.